Hi, I'm Markus Munger with Munger Physical Therapy, talking to you today about the 3 reasons to visit a physical therapist. Isn't it a wonder that when you have pain complaints, you have this mild relief when using pain medications? Even though it takes the symptoms away for a short period of time, it always seems to come back. And then once we've reached that intolerable level, we finally decide to go see our physician. All right, this is what I want to talk to you, like what is your next step? If we see our physician, they might prescribe to you an anti-inflammatory to just help with the inflammation. We might see that at the initial stages of your pain. They might consider an opioid. However, in today's society, we have this opioid epidemic where people are addicted to the medications and they can't get off, and they still have high levels of pain. You know, your physician might even consider x-rays. They might consider an MRI, or perhaps maybe an injection. All right, all these are options to your pain, but still not taking care of the actual problem. All right, this is where we start to get frustrated with our healthcare system because even after taking proper medications, you're still not able to do the things you love to do. For instance, yeah, you had surgery, but you still have the pain. You still can't walk well. All right, why is that? You might have had an injection, but the relief is short-lasting. The other is you might have an x-ray and you've been told that you have arthritis. Well, I'm here to tell you, if you're older than 50, all right, you're gonna have arthritis. So don't be set on the diagnosis you get. There's many of us that have disc herniations, disc bulge. We might have partial tears of our rotator cuff, and we still don't need surgery for that. You can rehab that through physical therapy in order to make a difference in your life. So don't be your diagnosis and look ahead. Like if you're still not able to pick up your grandkids, you're having difficulty with cleaning the house, maybe you can't work without pain, you can't dig as a construction worker, you can't sit at your desk for a period of time just to do computer work, like all these things are affecting your daily life. Perhaps you have to sit every time you got to do your household chores. Or maybe you can't go for a long walk with somebody on the beach, you know, out on the track. All right, this continues to create problems for you. So think about how pain has affected your life. You know, pain is something that all of us experience. And what I want to talk to you about here is just that most pain symptoms should typically go away in 2 weeks. I'm sure if you think about having a pain, you twist your ankle, you bend over, you get a little bit of back pain. Usually within 10 days, 80% of us, that pain will subside. We'll start to feel better. Every day is a little bit better to the point that pain goes away. Well, in 12 weeks, we're looking at the chronic end of pain, and at 12 weeks, we should notice that pain completely gone. All right, if you're finding out that your pain is still present even after 12 weeks, then you might want to take a look at talking to a physical therapist, being evaluated for a possible mechanical problem. And one of the benefits of physical therapy is that we take a holistic approach to the body's natural healing ability. And you'll find that if you consider physical therapy, we can offer 3 options for you. First thing is that we like to evaluate the body and the entire musculoskeletal system. So let's say, for instance, you're going to come in for knee pain. I'm not just going to be looking at your knee, all right? I'm going to look at your ankles. We're going to check your hip position. We're going to see what's going on at your back. Like, how do all these parts come together to create knee pain? The pain in the knee, that's the symptom, but it's not always the cause of your pain. It could be something on the other side of the body that's creating the pain of the knee. So if I just perhaps get an injection in my knee, all right, it might help for a while, but if I haven't changed mechanics in the body, then this pain is going to come back again, even though the injection made it feel good for 10 days, 4 weeks, 6 weeks. Sooner or later, you're going to kind of feel that come back again because the mechanics are poor. One of the things we like to look at is educating you. all right, to give you a good understanding of why you're having the problem. And then we'll do nice hands-on modalities such as manipulations of the joints, working through your muscles, progressing a stretching program, look at strengthening exercises, things that you can actually do in your home to help yourself heal your body. We need to get our bodies into an environment of healing. And if we're always in an off position or missing certain mobilities of our body, then that alone is going to continue that process of pain. Our body is mechanical, all right? We have a proper way that we move. We have a proper way that we heal, all right? Our body has this protective mechanism so that we don't injure ourselves more. That's when you find you have a muscle spasm, you get swelling, your body shuts down a muscle where it doesn't tighten as hard as it could because your body is trying to protect itself. The last thing is that we're pretty good at is our body is a great cheater. If I decide, even though my knee hurts or my back hurts, and I want to go from here to there, my body will find a way to get there. Even though I might have to limp, all right, I might have to use a device, I will find a way to get there. And as we start changing how we walk and how we move, our body will then create other problems. So instead of now just having my back hurting or my knee hurting, I might end up with my ankle bothering me or something else of that nature. So think about how we move, and if you find that you're moving different than you did 12 weeks ago, it's another good reason to talk to a physical therapist. Physical therapists are experts in body mechanics, all right? Knowing how physical therapy can help you can make a profound difference in your life and pain-free movement. All right, so we talked about the beginning, 3 reasons to visit a physical therapist. I want to list those out for you right now. Probably the biggest one, the first one, is there's no drugs required. We use the body's healing mechanism to promote health. The second thing is there's no injections. Physical therapy is cheaper than a series of epidural steroid injections. Just one injection in your body is almost $600. All right, we're not even close to a series of injections for physical therapy, and it's hands-on education, instruction, and a good healing environment for you. And the third thing is that holistic approach. Holistic approach, we're not using any injections, any medications, just you and us and your body getting it back into its symmetry, its homeostasis, a place of healing. That's where you'll see physical therapy at its best. So physical therapy, we're experts in healing the muscles and the joints, and I think if you look at us as an option for your system, I think you'll be super happy about that. I know some of you might say, well, what about surgery? I mean, surgery comes up often before physical therapy, after physical therapy. They might not even get to the point of physical therapy, maybe just do the medications and MRI. MRI says, oh, I have a meniscus tear, so I might as well have the surgery. However, something you should think about, and there's 2 studies you can look at. One is Mosley, he was in 2002, and then updated here in 2015 was Kirkley. Kirkley had the pointlessness of knee surgery for osteoarthritis was confirmed again. And what they found was they took a group, a placebo group, and an actual surgery group. The placebo group, they just put 2 holes in their knees, so it looked like a knee scope. And the other group, they did the surgery. And at the end, there was actually no difference in improvement. They both equally improved, even though one group did not even have the surgery performed. So again, there is mechanical benefits to finding out what's going on with your body as opposed to masking it with medications or doing a surgery to fix something that could be mechanical but not necessarily taking care of your pain. So I'm here today to tell you to stop ignoring your body's alarm system, which is pain. All right, just stop ignoring it. We do it all the time. We always think it's going to get better, and it doesn't. And our life square continues to get smaller. We're not running, we're walking. We're not walking, we're sitting. All right, we're not sitting, we gotta lay a lot more. So think about that pain system, like listen to it, and start to begin healing process with physical therapy. I'm Markus Munger with Munger Physical Therapy. I hope this was helpful for you to just understand the benefits of physical therapy and maybe what we can do to make your life much better. Be well.